Probably the biggest thing that we've overcame or enjoyed with IMS is the support that we get. If anything that breaks in EHRs are going to break. There's no such thing as a perfect EHR. And that is probably the main thing that we enjoy best about it, is the type of service that we get.
I think the biggest challenge for GFHO, coming from during that time, a small organization, was the IT infrastructure, the lack of that. We had computers and things like that, but no servers, no IT infrastructure at all. So that was one of the biggest, and a lot of credit to our previous CEO for establishing that for us. That process also allowed me to work with the Meditab team, Ronak and them, and Jenik during that time, and really establish a good working relationship with IMS, with Meditab.
So for me as a physician, it is important that I have an EHR that is customizable. And IMS is very customizable. And an advantage to that is that a lot of the customization can be done in-house. And so that is definitely an advantage to me. If I need something tailored to my own particular practice, that's something in many instances that can be done by our in-house staff. However, if there is something that requires more expertise, what I love about IMS is that the support is always available and very responsive to my needs as a clinician and an end user.
Some challenges that we had, of course, was that tracking. We couldn't keep track of those patients. So now, when it comes to CMS and them allowing us to bill for the community health worker, then I can go into IMS and pull a very specific report that will give me that list of patients. Or say if the provider, they have patients and they're like, I don't know who would qualify for this program. I know they need help, but how do I determine who those patients are? And there's a report in that new module that you can go in there and 2 chronic disease patients assigned to whatever doctor you're looking for, there's your patient list. So it's helped me keep on task and on track.
IMS actually makes it very easy on those folks coming into a new EHR, that I think the speed at which they're able to adapt and the ease of use, we have not had a single clinic that we purchased that didn't say this is the best EHR we've ever had. And a lot of these providers have been using EHRs for 20 years.
From check-in all the way to the whole billing, everything's in one program. So it's really easy to kind of track where work is going and where it's at. I think it's made the process a lot easier rather than following paperwork and things like that. Then, everything's in just the program.
IMS has been, in my opinion, the best decision that our health center has made in my tenure for the patients, for the organization. So it's one database, it's one location to get all the information you need. The patients may not realize it as much as we do, how it standardizes care from one location that's 70 miles from the other location. So we have 5-county region. So all these people are connected by culture. We all have a slow dialect, but that don't mean we're slow. But Meditab and IMS, I think, has been the key to streamlining our processes, improving the quality, making sure we're closing the loop on processes and patient care. So the patients have benefited even if they didn't know it. Pat Willis was our chief nursing officer at the time. She always said implementation is never done. And we're still seeing that today. I think the continued innovation, patients continue to evolve in their knowledge of technology as well. So I think the further we go along with IMS, we evolve with the patient needs, and it was our number one choice in my tenure to be a health center that is 100% patient focused.
If we need something and we need it added, say if there's a new UDS measure, I can go in and I can do that myself. I can link a code and I can build a template, and it's just so easy to capture the data we need. And so for us, it just gives us the ability to make changes and be able to get that data instantly. So IMS just makes being an FQHC easier.
So IMS, I believe, has a positive impact on my relationship with my patients. I particularly like that I'm able to converse with my patients via the patient portal. The patient is able to contact me directly without having to go through the front office staff. I think that builds my rapport with the patient. I think it develops my relationship with them so they know that I am accessible to them directly. IMS also helps build my relationship with the patient. I particularly like that I'm able to provide customized care plans to my patient so that they can leave with something in their hands to kind of reinforce my treatment plan.
IMS is so customizable. If I come up with an idea and I spill it out to my team, it's like, oh, yeah, we can do that. Absolutely.